diagnostic tests. So let's talk about consent. When do we need to get consent in the hospital?
Every time there's a procedure done?
Yeah, so here's the thing though. When you go on admission to the hospital, you kind of sign a bunch of waivers and forms. So in that, you sign kind of a general consent that allows the hospital to do labs and x-rays whenever. So that's why in the hospital, when someone goes and draws your blood, you don't need to like sign every time.
Okay.
So you need to get additional consent for any other tests. But you already signed consent for labs and x-rays. So like if they're going to get a urine analysis, they don't need to sign. They're going to draw your blood. They're going to get like a sputum culture for the lab. They're going to get any culture.
Mm-hmm. So no consent, no extra consent for labs or x-rays?
Yeah, because you already signed like a general one,
okay.
Broad one on admission. So you need additional ones when you're doing other tests. So when you get a consent, usually the doctor kind of explains the procedure, whoever's performing it explains the procedure, and then it's your job at the end to make sure that the consent is signed and to make sure that the patient doesn't have any more questions. So that's why it's important for us to kind of know about these so we can ask questions and just give them better feedback. Another thing to remember is, do you want to get consent before or after pain medication?
After?
Before.
Before?
Because after, they're kind of sedated, because it's depressing, right? They kind of feel lethargic, things like that, so.
They're also usually more motivated to sign it.
Yeah.
Yeah.
That's true. And so, when they sign it though, make sure they fully know what's going to happen, so explain to them what the procedure is about, who's performing it, the role of what the person is going to do, like the performer, and then what the patient has to do during the procedure. And you also want to provide them with like adverse effects that are possible.
It's like a woman in labor.
Huh?
Do you want to have an epidural? Before she's like, no, I don't want to pay for one. And during labor, you're like, yes.
Did you have epidurals?
Yeah.
Yeah.
It's like, I don't care if they cost $1,000, I want one right now.
They're not that expensive. Usually
No.
insurance covers it.
Yeah, usually.
Yeah, that's crazy. I saw some persons.
So consent, you said, explains the procedure, the adverse effects, and who is doing it?
Yeah, like the doctor is going to say, I'm going to be doing this to you. And they're going to say, like in a lumbar puncture, they're going to be like, I'm going to be putting a needle into your spinal cord and aspirating SCF fluid, and your job is to stay on your side and be still. Kind of like that.
Right, and what were the other things that?
Adverse effects, like something potential like that. What the procedure is, and just to see if they have any questions, basically. Just like all information about it. And like why they're doing it and what this is going to tell.